7 months? 7 months. 7 months since you had your procedure.
Yeah, it's true. Yeah, about that.
And that's 50, nearly 60 kilograms
Yeah.
down.
How many kilometers?
Nearly 60.
60.
Nearly. Yes, we're looking at a 56.7.
Yeah.
So 56.7 kgs. That's I think pretty much nearly a third of your weight off.
Yeah.
Yeah. Yeah.
That's from 170.
Yeah.
Yeah. 170. So I think you're doing really well. Of course, I think for 7 months that's still, I think, extremely good by any standard. And I think what that means is that if our target was about 80 or so, then you're most certainly on track to kind of hit that. You know.
30, about 30 kg to go.
Yeah. So conscious that of course you tend to lose a good chunk of the weight in the first 6 months, which you've done. So that's an advantage, and then you add in the fact that you're still losing weight week in, week out, which you are.
Yeah.
Which means that you're doing the right things. So I think that's important. I think moving away from the weight, the truth is that you must notice so much of a change in your, just you, how you in that. So maybe you can elaborate a little bit on some of the things that, just again, apart from your weight, things that you feel that you feel is a good, encouraging and positive thing that you notice.
I think sleep is major for me. I had a very bad, let's say, sleep pattern prior to the surgery. So I think even from as soon as I went home, so that's what day 2 of the surgery, like he picked up on that I slept. It was a very noiseless sleep, and I definitely felt more relaxed in that, more restful sleep. I have more restful sleep now, so that has major impacts. I'm just feeling lighter, very flexible, more energetic than I definitely used to feel prior to surgery. So I think energy levels are up, sleep is much better. Well, you said non-weight, but making better choices with food, and I think just generally having a more positive outlook on life in general. Yeah, just wanting to get more out of life, and just
because of course, I remember when we were in conversation about going for this, and I don't know whether, I can't remember my memory, whether we were very clear on certain expectations. It's hard to be specific, but I think in that regard, you have some of your expectations been met, as you guys were preparing, and I know we had a few meetings before surgery, because of course there were things that we needed to iron out and I think discuss to make that strong case for surgery, either doing something more invasive. So we went through that, I believe. We met 2-3 times.
about 3.
Three.
Yeah.
There's a little bit of back and forth.
Yeah.
We were trying to be certain that we were making the choices that was safe, and of course.
Yeah.
So yeah, from you guys' point, do you think your expectations have been met?
Absolutely, because I know prior to the surgery, at those initial times we had those meetings, we're a little bit skeptical about, if it was going to be safe to do it in Nigeria or do it abroad, based on she had the kids in the US. So and some stories that we had learned about, some of these surgeries or procedures that go sour,
So
you
things
know,
go wrong.
go
and people
wrong,
start
things go wrong,
blaming one thing
blaming.
or the other.
So
Yeah.
and if you could still remember, you remember one of those. I think it was the last one before we made the decision on when I started sharing some of these experiences. I know you were taken aback with that, but you know sometimes I just like to confront issues. You know, try and highlight some maybe perceived gray areas that we want to be sure that you know all those things are being considered. So, but you know, afterwards and after the discussions we had, it was very clear that you know you knew what exactly, and of course, some of those responses that you gave were very. At least if you can explain things very clearly to a 5-year-old, I mean, it shows that you really understand. You know,
Of course, in fact, so yes, that is convincing you guys that, of course, because everything is about our comfort and choice.
Yes.
Right?
Yeah.
So I think this is obviously very important, and it isn't always easy. I think to make a very strong case against, let's say, an objection or anxiety or worry from a patient point of view, because some people don't want to change their minds. They just want to go through the process, right? And you go through it, and then they eventually say, well, actually, doc, you know, and that's one thing you guys, I must give you credit, because we, you know, every time we met, we progressed.
Yes.
Because it is sometimes a ladder of decision making. You progress,
Exactly.
you go back, you reflect. Of course, you know, we come back, we talk again. And I think on a few occasions, I think you asked for another meeting, and then I think I asked for another meeting, and I think that highlights maybe the importance of, I think, having at least a reasonably cordial rapport with your patient
Yeah.
in terms of communication, right? And then
Yeah.
eventually trust, and of course, you know, maybe. And I think that you know, you guys were really good, and your husband, of course. I think I was very deliberate towards you. I think more to sort of pull you in so that we can have an agreement. And I think the reason for that is that at the end of the day, I think, you know, you want the best. You want the best for yourself. Your husband wants the best for you and the family. You know, and I think ultimately, once a patient understands that the doctors and nurses also want the best.
Yeah.
You know, within the limitations of what we can offer. So, you know, look at us now, 7 months down the line, and you know, and we're all very pleased for you. We're also pleased for you clearly. I know you're being very conservative in how you're presenting it, because you're just holding back. You don't really tell us exactly some of the, but that's quite normal, because at the end of the day, I think, you know, if you really feel and look at what you've achieved, I think you could be nothing but proud of yourselves. You know, and I think I think we're very pleased, and you know, and also your husband, you know, can't deny that he has benefited hugely from that. So you know, again, that's a story for another day.
Yeah.
But I know he has, you know, because of course your husband is not exactly a man who isn't involved in the dynamics of the family. Even though I suppose you go Angola, right? Yeah, it's a lot of back and forth. But I think you've always been here, every key point.
Yes.
To make sure that everything has been you're comfortable with, so that everybody doesn't feel that they're taking any risk. So yeah, so it's good.
So Uche still has some things to say. Don't you have more things that you saying she was conservative about something? You know.
Tell us things. So what? I mean, of course.
There's a lot to say.
I need to. The point here is for us to. You're experiencing this benefit, and you took all that was available, all that was your option, and then made a choice. You know, and honestly, I don't think anybody will listen and hear what you've been through and what you've done and say that you haven't benefited. But of course, I want to know you. What what are the? Is there anything that you really want to tell us?
Okay.
Share
about the process in general, right?
Yeah, and
The
how you
before,
feel and
the
who you
before.
are. Yeah.
Well, the befores and the afters. Well, as I said, it took us quite a while to come to the decision point. I think it was about a year in and out, you know, even with the pre-test that we did. When we do the test, I'll take advantage that he's not around and just wait there for him to come back before we book for the. So all of that took a year, and in all that
Was
time,
it a year?
about
a year. Okay.
yeah, about a year.
Without Okaro, right? Was
Without-
it I mean, when you
Well,
say
we
yeah,
started the discussion. I know it was early last year. I mean, and we didn't do the procedure till November, so that was like almost a year. Yeah, it was almost a year, and it was, how do I put it? It wasn't quite. Let me not say accidental, but it wasn't planned out. Like I never thought I would go down this path. Why? Because surgery is not something. It's something that we're very uncomfortable with, both with my family where I'm from and even with my work. Very, very uncomfortable with surgery. It's such a big deal in our household. So it's not something I've struggled with weight for more than, in fact, all of my adult life. I've had, you know, periods of getting it right, working out, losing the weight, but then again it comes back on. So I've struggled more than maybe 20 plus years, let me just call it about 20 years. So, but surgery was never in my contemplation. So it was just, you know, a random visit I had with my mom. My mom had to see a nutritionist, bringing Mrs. Sherry's. So we're at Carib consulting on that. So when she was done just talking about, I mean, it was nutrition and all that, and you know, somehow I started talking about my own predicaments, you know.
So that, you think your mother did a decoy? She brought you there deliberately?
I don't think so. I think it just happened.
Kidding.
That was totally coincidental.
I'm just kidding.
Yeah, I know. Yeah. So that's it.
So from your mom then to you, and
Yes.
that's how it all became.
Yeah, that's how
Wow.
Dr. Sherry's then mentioned, oh,
Okay.
there's this weight loss interventions. And to be honest, I probably thought it went, I mean, they were doing such in Nigeria, but I've never considered that possibility. So when she said that, it really just sowed a seed in my mind, like, oh, okay, so this is possible here and now, because I don't like surgery to start with. Then to fly abroad to have the surgery, like, count me out. I was never going to do that. So with that, you know, it just you know, making me more comfortable at the thoughts, and you know, eventually. So what happened after the first visit with Mrs. Sherry's, and so I would always, when my mom had a follow-up appointment, I always, oh, let me take you, let me go with you. So after they finished with her, we'd always have our own tete-a-tete till I booked my first consultation. So that was actually, so in all of that, just warming up to the idea, and so that was for me. So when I started accepting the idea of, okay, I could do this is a possibility, and I mentioned it to him. Actually, I was prepared to have a what's that word? Not kickback. Resistance. I thought he would, like, no, surgery. Get up at 5 a.m., run around the whole street. You know, I just thought he would bring up, just do your. But he was quite okay. What's it about and all that. And I also attended the webinars. The webinars you also. I think I attended about 3 or 4.
Oh,
like
okay.
Dr. Shiris put me on to, I think there was one shortly after we met first. There was one, so I joined it and heard from other people, and the whole, you know, so it was just about information for me. And the more I learned about it, the more I started accepting that, yeah. And then when I discussed with him at first, I was already expecting that I had done all the disadvantages, waiting to, you know. But he was just like, oh, that sounds good. You know, who are these people? Like that. So that's okay. I'll book an appointment for when he's around. And that's what led us to here. So at that point, and it really came at the, let's say, at the best point really, because I was the heaviest I've ever been. Like, at 170 from, and the irony, when I started the consultation, I was maybe 160 something. But I know that a day before, the day of my pre-op diet. I climbed the scale and I saw 170. I was like I couldn't even think of if there was no going back at that point. Anyways, absolutely no going back. But I think for me it was just like at that point I'm like, I don't think I can help I've done it in the past, I've lost a lot of weight in the past, or this diet or this workout. But give it a few years, I've gone back to ground zero. So I've had lots of starts and stops in between. But at that point I was like, I don't think I can. I didn't even think I had the energy. I was always so out of breath and just tired all the time. So like, I don't even think I have the energy. Things I used to do then, play squash, go to the gym. Like, I didn't even think I had the energy. So I'm like, oh, this has come. This is the Messiah I've been waiting for, actually, in this journey. So let's just grab it by both hands and, go with it. So he was obviously very supportive. And then my family, well, they didn't have a choice really, because I was bent on this is what I want to do. And so long as he had, he was with me on that. So it was, of course, they had, why not go abroad? Why not consider here or consider there, or Turkey or this? People are, I'm like, for whatever reason, if I'm going to do this surgery, I'm going to do it here. So it's either I'm doing it or I'm not. That's how convicted I was. And having had all the consultations and, all the webinars I attended and just all of that independent research, I just said, I'm going to do it. If I'm going to do it, this is going to be the place. So yeah, so it didn't, even as at the last consultation we had, which I was reminding him this morning, last consultation we had before we decided, and that's coming into that consultation, we didn't plan that we decided that day. We just like, okay, let's just go, it's part of, let's have another consultation. And so we're just like, okay, if it's going to happen, we have one, there's a slot before the end of the year. So anything other than that is going to be next year. I'm like, to carry over this topic again till next year, like, no, let's just. And so it was instantaneous, in as much as we have been talking about it, going back and forth. Yes, so it was at that piece, you're like that, okay, this is it.
And again, at that point as well, you remember I also called your attention, my parents were having, because of course there was a lot of plans.
Okay, yeah, end of the year
my attention,
activities.
Because I just wanted her to know, and it actually affected her at that time because she couldn't eat anything. Everybody was wondering, everybody came from everywhere. Everybody was wondering why was she not eating as much, So, but it's good that we made that decision.
Oh yeah. No regrets. It was the right time. It was the right place. The right people. Everything was actually aligned.
Exactly.
I wouldn't have had it any other way. And when I think of other possibilities as they were, by the time we opened out the discussion, okay, this is what we have planned to do. We were getting lots of advice. Solicited and otherwise. Oh, there's this auntie's cousin's brother in the UK. This is what she does. Like, we can just go there, speak to her. So it was just, there was a period of confusion. Okay, do we really? Are we really?
No. But at the time we spoke with you, quite honestly, and of course, my
Mrs.
Sherry's.
Yeah.
I was very convinced within myself that.
Here or nowhere.
I think, of course, as I said, we met several times, and I think it highlights how difficult some of these decisions are, and they're not also to be rushed because of the seriousness of the decision and the change to your life, lifestyle that affects you, of course, your husband, and the rest of the family.
Kids, yeah.
It's clearly, not that we want to become a little bit more woo about it, but it was destined when you met Sharice, your mum, and the seed was sowed, as you said. And that's what looking back can help us to understand that if your soul or spirit rejected it wouldn't happen. It just wouldn't, because the human spirit is usually, or the soul is what actually allows you to make these tough choices. Or if your husband had given you a really big, strong pushback, that may also have changed the response.
Oh yeah.
And of course he didn't. And if he himself had agreed, but came here and he didn't like the environment, he would have obstructed it. So that's how things happen, and each turn and twist ended up where you are.
Mm-hmm.
You know, and I think it's, you know, you're both very open-minded, and I think that's really important. You know, in terms of just tell me more, tell me more, tell me more. You know, and that's really important. That is really important, I think, because it means that you're not prejudging anything.
Yeah.
And you're also open your mind to changing your mind, and I think that's very powerful. And I think your sequence, I think, highlights that. I think very, you know, of course you've done amazingly well with your weight loss and the impact on your, you know, diet, so which is really important, I think. But for me, the most important message, if you asked me around, you know, what we are, where we are now, is how you have been very deliberate and methodical and patient within your, you know, as a family unit, to make a decision that is impacting everything. And I think that is, for me, it comes up right top. And I want to, you know, obviously recognize you for that, because I think it's easy to shut conversations down. They always say that it's easy to go to a zone that you feel uncomfortable or unsure. Shut it down. It's courage to go, you know, it's courage to go and say, well, let me talk about it. I don't really know, but I'm going to be open-minded. I don't really believe it, but I'm going to go do a check.
Yeah.
Really does that. And also your husband, who was in a lot of time over off-site.
Yeah.
For him, he'll be thinking, if anything happens, who are they going to turn to? It's him, because it's our tradition, right?
Of course.
Okay, man, what were you doing? Where were you when everybody Macarinos, you know, that's our culture. That is our culture. They'll blame you that you were not paying attention.
Yeah.
So I know he would have felt that pressure a bit. You know, I'm sure you did.
Of course, that's what necessitated most of the questions I tried to clarify.
To understand that. So it's a courage and a conviction, and of course the fact that it has worked out, and we can do that in hindsight and acknowledge or recognize it. But it's still something that has to be talked about. You know, because it is courageous. It is.
Honestly, this has changed,
you know,
the entire dynamics of our house. We are now more health inclined.
You have children. We have children who are watching, of course, observing. So the impact does go into the next generation to an extent, I think. So I must say I respect and, you know, you guys really immensely for having that courage. It's not a draw fella, as they say in Igbo land, a draw fella. It's fear. You're confronting an obstruction, and you're finding that the ability to pass through it. So it's a lovely story. It's a lovely story. It's a story, you know, of Dina Wunye, a story of. I mean, the story is.
No, the divine connector was Mrs. Sherry's, right?
Yeah.
She was the divine.
She
was positioned.
No, it's a very
strategically positioned.
You know, so I think, keep it going. I mean, I think the target of about 85, 90 is very.
85, 80.
80, 85, yeah.
Pushing
I know you will. You have a good chance of getting there, because I think, you know, you're consistently going down. So just keep it up. Make sure the exercise levels is good. Make sure your exercises of mixed variety, resistance, cardiovascular. Protect your bones. Protect your muscle. So those are the two main, kind of systems you need to protect.
Okay.
Your bones and your muscle.
Okay.
Because overall, that's the one that is at risk. You don't want to lose too much muscle. You don't want your bones to thin out. So you just do all the things to protect those. You know, exercise, of course, calcium, making sure you're taking the right amount of protein, so on. So taking vitamins. So those are the two, the kind of two organs, and then the rest is just obviously making sure, which you will, your digestion is good, and all of that. So that's kind of really key.
Yeah.
Right. So I think we've had a good discussion. I think we've highlighted some of the things that I believe at this stage are really worth looking back and saying, well done to both of you?
But the exercise, sometimes I just wonder if we take exercise out of the equation. I know I discussed it with Mrs. Sherry's at my last appointment anyways, and I think that's what gives me that bit of a kick to just keep going at it. Because
Which is the exercise?
Yes.
What's your exercise at the moment?
It's mixed really. I have this aerobics class I join, and they do all types of programs. But they will do kickboxing, do normal aerobics. We have our yoga days. We have strength training mixed with aerobics. So, but outside of that, mostly at home, I do a lot of strength training. So I use the class to get in my cardio, to just get my blood pumping, and then at home I do a lot of strength training. Because my the secret thing that bothers me sometimes is like, what if I just stop working out? Yes, it's not good, and it shouldn't be an aim or a goal, but would my results?
Your weight loss results be any different? As in, is that what you?
Yes, be any different or stroke. As I wonder sometimes if I get to my
target,
when I get to my target, and I say, oh, I've gotten here, let me chill, let me relax.
So, and
I'm still mindful about intake and all that. Yeah.
So I think you have to frame exercise, in its appropriate context. Are you with me? So again, weights and weight management is very, very key, for exercise. But I think exercise's benefit for you is not really around the weight. Strictly. You're not doing it for the weight side. You're doing it to preserve your muscle and bone. Resistance is really good for bone growth. When you pull muscle, when you pull gym work, the stress on the bone increases bone mineralization, and also builds the muscles up. So no, you have to look at this on longevity and you look at longevity, which is living a functional life.
Yeah.
Well, are you recording this? So I think some of this is worth maybe highlighting. We can snap this out as a separate conversation about exercise and longevity. When you wear the hat of longevity, the hat of living what is now considered not a long life, but a functional life. So this is a life where up to the point of end, you are active. You want to do something, you get up and do it. You're not restricted. So that's the functional life. You can only have a good functioning life if you have good bone and good muscle and good joints. Yeah? Strength, ability to lift, obviously bend, whatever. That's why you exercise. So you need to put that as a form. Now it's a long way away. You think when I'm in my 60s and 70s, but the investment is now. So it's worth making that effort. So you must put your exercise in the category of longevity and functional life in the mind. So it's a bit of a framing. It is very important you do that. What is very clear is that people who exercise regularly, and it could be, again, small level, low level aerobic or high intensity exercise, all of them have a benefit. It is the most single independent, proven factor for increasing the length of a quality life over and above any other treatment, even smoking to an extent, yes. So when you look at it that way, and then you combine it with all the other things, healthy living, so better food, better fiber. You then talk of anti-cancer, you talk of immunity, you talk of brain function, fighting dementia. Of course, diabetes is automatic. You're fighting diabetes, you're fighting hypertension, you're fighting cardiovascular disease. It's a no-brainer. It is a no-brainer. But I agree, because it's for the future, people tend to just dismiss it. So I think
Put
you
it on the back burner.
no, so I think your investment in the exercise is so relevant to your functional life.
More so.
Oh, huge. Mood.
And I
sleep.
enjoy it anyways. I do enjoy
Oh no,
exercise.
it's a boost. It's a
Yeah.
massive boost. So, so I think I think you're absolutely right. You're doing everything in the right order. I think you're just gonna have to do a bit of reframing. So as you start to progress through the the weight loss initial journey, it's a reframing, which is all in the mind. So you shift one to another category. And don't forget, you can pull one category out and put it in your mind, and because all we need to do is what we call, we want to be flexible in our desire. That's all. To help us, because it's a battle of internal. It's an internal battle, as you know. Life is an internal battle. It's not an external battle.
Yeah.
Battle of the mind.
Completely battle of the mind. And you need systems to help you feel that, overcome the internal resistance, which is to say, let me just chill. Let me have that.
I mean, the truth is, well, for me, just like this popular said, no, I can never turn back. I feel like I won't get to the point where I won't want to work out. Because even now and then, maybe, one thing or the other shifts me out of my routine. But exercise, I've got to the point where if I don't work out, there's a longing.
Good.
So I would never not do that. I don't even plan to ever put it aside, but I just, just wondering.
Just thinking, I think it's very important that you ask those questions and you challenge yourself, because this is like you're literally just thinking aloud. This is a think aloud thing.
Yeah.
I think that's again, that just tells me how your mind works, and that's very powerful. Some people will keep all the inner thoughts and they don't really voice them, and so there's not a conversation, there's not some dialogue with your thoughts, and then of course it comes out. So it's like a therapy session. It's like a therapy session. It's actually like a therapy session. And the purpose of a good clinician supporting you is to do that with you, which is obviously why Cherise obviously anchors this on the platform of just looking at, no, it's not your way that I'm most interested in. I could be a surgeon, right?
Yeah.
I could just say, wait, it's all right. Good, bye. But no, we're going a little bit
general wellness.
Because we really want our patients to really benefit from what they have aim to do and take on the risk, and some of it is just purely having the right conversations at the right time.
Yeah.
And then they keep reminding you. Eventually, you're gonna I have to do this. But you're way ahead of that. This is not really for you.
Yeah.
You're way ahead of that. So I think it's been a good discussion. I think we've covered some of the most important things. Now, of course, it's important to mention that you do practice law, so you're a critical thinker. I think it's important. What we do for a living and how we have been trained in university and our careers is our way of processing information.
Yeah.
And the systems, scientists will always be scientists, and so I think it's important to highlight that, partly because of course it feeds and helps you to make that preemptive, analytical, methodical decision.
Yeah.
So good. Yes. Yeah, you can pause it now. I know because I wanted.